Now, I'm going to carry on now and look at the research from China. Now, I know people might be getting a bit bored by now, so I'll put this up as a whole video at first, and then I'll put it up as two halves, so you can watch the whole thing or watch in two lumps, whatever you would like. But it's some pretty interesting stuff, actually, and it really is bemusing that the WHO forget. Well, I don't know if they forgot, but they didn't put it on their website anyway when they were talking about those other things that we are already aware of and have been, it's fair to say, have been discussed on other platforms. Right, let's sorry. Let's in serious matter. Let's get on with it. Let's get on with this. Vitamin A deficiency. This is the paper. Is associated with severe mycoplasma pneumoniae. Now, that's in italics because that's the name of the organism. That's the name of the bacteria. Mycoplasma pneumoniae. That's how you pronounce it. Pneumoniae is the organism, and that causes mycoplasma pneumoniae pneumonia. And pneumonia, of course, is the infection in the lower parts of the lungs, in the alveoli, particularly vital for gaseous exchange. Now, this research was actually done in Beijing, where, coincidentally, this outbreak occurs. So, particularly surprising. So, presumably in its library, the WHO have got a copy of this paper of a particular deficiency with this particular mycoplasma pneumonia disease identified in 2020. And yet, when there's an outbreak of this specific disease in the specific area, they don't mention it on their press release. Anyway, can't explain that, but right. So this was done in Beijing, where this outbreak of the mycoplasma currently is. 122 children that got sick, 0 to 15 years of age. Now, it doesn't sound like many for a research study, but these are all children that got sick, so it's a pretty good sample from that size. Now, 52 had severe mycoplasma pneumoniae, so the severe form of the pneumonia. 70 had the non-severe form, so they still had the pneumonia, but they weren't as ill. So 52 were very ill. 70 were infected with pneumonia. Still had pneumonia, so the infection was still in the tissue of the lung. That's probably the simplest definition of pneumonia: infection in the tissue of the lung, as opposed to bronchitis, which would be the upper airways. Pneumonia is the lung tissue itself. The lung parenchyma, the alveoli, the gaseous exchange areas of the lung. Now, a very interesting study. Serum levels of vitamin A, D and E were measured and compared and correlated with severe mycoplasma and, non-severe mycoplasma and less severe mycoplasma. Now, what did they find? Very interesting. The age was older in the severe cases, the severe children, than in the non-severe. So the age was older in the severe ones. So these ones had the more severe disease, average age of 7.12 years as opposed to 4.0 years. So that is interesting. The age was older in the severe ones. So it looks like these children had more severe disease than slightly older children. So older children suffer more severe infections. Right. Now, vitamin A deficiency was present in both the non-severe mycoplasma pneumonia and the severe mycoplasma pneumonia. So both had vitamin A deficiency. Vitamin A levels were significantly lower in the severe ones than the non-severe levels. So what we see is the children with the most severe form of the mycoplasma pneumonia, the children with the most severe forms of the pneumonia had the lowest levels of vitamin A. The children with the higher levels of vitamin A had the less severe form. So lower vitamin A levels, more severe disease. Higher vitamin A levels, less severe disease. And these were very statistically significant when they did the statistical analysis of this. And they were the vitamin A levels that they found with error bars. They're just rough figures. Vitamin A deficiency was defined at less than 0.2 milligrams per litre. So we see here, these are less. That's well less than 0.2, isn't it? So even these children here with 0.19 with the less severe disease still had deficiency. They were still below the 0.2. So what we're seeing is the majority of children with non-severe and severe mycoplasma pneumonia had vitamin A deficiency, but the children with the lowest levels of vitamin A had the most severe mycoplasma disease. It's a pretty clear correlation. Subclinical deficiency was 0.2 to 0.3. Normal range was 0.3 to 0.7. So we see normal range 0.3 to 0.7, and the people with the most severe form of the disease only had 0.15. We can see that the levels were really quite low. That's about 5 times lower than that approximately. So quite interesting correlation there, and of course doesn't necessarily tell you it's causal, but we know that vitamin A is so important in immunity anyway. You would surely think it's something well worth thinking about. Right, so children with lower vitamin A levels suffered more severe infections. Children with lower vitamin A levels suffered more severe infections. Vitamin E and D levels were also measured in children with severe samples, and these are the figures that they found, the blood levels that they found there. But both the severe and the non-severe did not show deficiency of vitamins E and D. So this is the key thing here. So they looked at vitamins A and found that there was a lot of children deficient in vitamin A, and the children that were more deficient had more severe disease, and the children with suboptimal levels were more likely to get even non-severe pneumonia. But in this population, they didn't find a lot of deficiency in vitamin E and vitamin D. So it's vitamin A which seems to be the problem in this particular population. And as I say, I've seen this commonly in Asia. I've seen vitamin A deficiency in children in India, several parts of India, Cambodia, Thailand. Common in Asia. Don't know specifically about China, haven't worked there, but this study clearly showed from the Beijing doctors and scientists that it is a big problem there. Vitamin A deficiency odds ratio was that's like 1,000 times more likely to get really sick, up to about 1/3 more likely to get really sick. So even if it's only like a third more likely to get sick with optimized vitamin A levels, that's well worth doing. And it could be that, because this is due to the small sample size, that we've got these wide error bars. So it could be that children with high vitamin A levels are 1,000 times, or adequate vitamin A levels are 1,000 times less likely to get disease, or 3 times less likely to get disease. But even if it's anywhere between those, hey, that is worth having. And let's notice here that this is very unlikely. The P is 0.009. Very unlikely that this result arose by chance. So this is protecting against severe mycoplasma pneumonia. Deficiency of vitamin A deficiency under 6 years now. So under the age of 6, 85% of children were deficient in vitamin A. Over the age of 6, 62.5% of children. So in this area in Beijing, they found the children coming in who were ill. 85% of these children were short of vitamin A, well, between 62.5 and 85% short of vitamin A. So we've got all these factors. We know that vitamin A is necessary for mucosal immunity. We know that vitamin A is necessary for the normal functioning, working with vitamin D in the normal function of, as far as I know, all the immune cells in the body, but certainly the T lymphocytes, as we looked at that specific research study on. So we know it's necessary for mucosal immunity. We know it's necessary for the functioning of the white blood cells, the immune cells, and other cells. We know that up to 85% of children were deficient. The children that were most deficient had the most severe disease. It's a pretty compelling case for testing the vitamin A levels in these children and optimizing the vitamin A levels in these children. And the authors do really seem to firmly believe this. Vitamin A supplement could reduce the incidence of severe mycoplasmic pneumonia. This is now the authors can't say this based on the study that they did. But this is based on their reading of the adjacent literature and putting everything together as we have just done. So really very likely. Now the conclusions that the authors come to here. And again, I think it goes without saying, isn't it, that vitamin A is remarkably cheap. Remarkably cheap. New drugs, perhaps, to treat mycoplasma pneumonia could end up being expensive. I mean, maybe not, but who knows? Expensive drugs could be invented. Could be. Never know. But vitamin A, essentially free. Right, conclusions of the authors. Vitamin A deficiency is associated with severe mycoplasma pneumonia and more likely present in the younger children. Now, I know there's some conflict here with the age levels, but just go with this general conclusion. It does make sense. Therefore, it's important to monitor the supplement vitamin A in mycoplasma pneumonia patients. So let's just clarify that. This is what the authors are saying. Therefore, it is important to monitor and supplement vitamin A in mycoplasma pneumonia patients, these children, and that seems to be what's causing this outbreak in China at the moment. Now, this is potentially good news for Western countries, because although there has been this mycoplasma pneumonia increases in the amount we're seeing in China, Denmark, France, Netherlands, possibly in Ohio, there's more of that there. But in Western countries, adults and children are much less likely to be vitamin A deficient. But it does show the importance of monitoring this and we need to do much more nutritional screening than we are doing. We've talked about this in the context of vitamin D, but it now looks like it's also the case for vitamin A. But basic nutritional, talking about what diet children eat and talking to mothers about diet, and as long as the food's available, could potentially, well, I would have thought essentially completely eliminate vitamin A deficiency. So a very obvious thing to do. Therefore, it's important to monitor and supplement vitamin A in mycoplasma pneumonia patients. So, problem in Asia. Could this spread to areas of the world? Pakistan, Bangladesh, India, Southeast Asia, where vitamin A deficiency is more common in children? I'm afraid that is a real possibility. Is it likely to be a particularly big problem in Western countries where vitamin A deficiency is not there? We would hope significantly less so. The other variable here, of course, is there some new virus in China? Now, of course, the mycoplasma is not a virus, it is a bacterium. So what am I talking about? Well, any viral infection of the respiratory passages is going to potentially predispose to secondary bacterial infection. So is there some new virus going around in China, spreading rapidly, predisposing many children to the mycoplasma pneumonia, exacerbated by the deficiency in vitamin A? If there is a new virus, of course, that virus could potentially spread, causing respiratory infections around the world and therefore increasing the probability of post-viral bacterial respiratory infections. We simply don't have the data to answer that question. Just a few more details from the paper. Mycoplasma pneumoniae frequently causes community-acquired pneumonia in children, and this occurs throughout the year. So very often we don't have the seasonality. That's why the seasonality in China could be secondary to viral infection. That's quite possible. Can be transmitted by droplets, presumably by aerosols. Children of all ages are susceptible, particularly if they're short of vitamin A, it would appear. In recent years, the number of children with mycoplasma pneumonia has increased, so it's becoming more common, at least in China. And they have a prolonged course of the disease. So what these authors are saying is there's more of this around in China, more of it, and the children are getting sicker. The disease is taking longer for the children to clear, which is why they're so keen to publicise their findings on vitamin A deficiency. Typical symptoms: fever, wheezing, difficulty in breathing, chest pain and chills. Mycoplasma pneumonia, particularly refractory or severe, often results in pleural effusions, atelectasis. So pleural effusions, collection of fluid around the pleural membranes. Atelectasis is problems with the lower airways particularly, and other organ damage. Now, if it's particularly severe, so severe means the disease is severe. Refractory means basically it's not responding to treatment. And this is a problem because of the antibiotic resistance. So part of this could be the antibiotic resistance, which we reported on in the last study, again from data, from peer-reviewed information from China. Vitamin deficiencies lead to higher incidence of respiratory and digestive diseases, particularly in children. So again, yes, we know this is true because the vitamin A deficiency reduces the quality, the integrity of the external and respiratory and gastrointestinal integuments. Vitamins also significantly impact on disease prognosis. So children that are short of vitamins generally, they're going to stay sicker for longer and they're less likely to recover. Our findings show that vitamin A deficiency was significantly correlated with severe mycoplasma pneumonia and more likely occurred in the younger children. Vitamin A plays an important pleiotrophic role in supporting normal mucosal barrier. It does many things in supporting the normal mucosal barrier. So important to stop the disease getting in the first place. So hopefully most diseases doesn't get into the body tissues, fluid spaces at all, because it's prevented from getting in there through the mucosal barriers. It's only when it gets through into the systemic parts of the body that the white cells need to kick in and do their job. So working on both levels, as we said, with the result of increasing risk of invasive pathogens. So you get invasive pathogens if they get through the barrier, if they get through the mucus of the respiratory tract, if they get through the mucus of the gastrointestinal tract, then they're more likely to get into the areas inside the body that should be sterile. More information still from this paper. Children who presented vitamin A deficiency were more likely to get an acute respiratory tract infection and diarrhea. So again, vitamin A preventing respiratory and diarrhea illness. It regulates cytokines, so they're more likely to get sick if they're short of vitamin A. The function of macrophages, that's these eating cells, big eating cells. Neutrophils and natural killer cells were impaired. Neutrophils are particularly active as as antibacterial cells, natural killer cells, which will kill virally infected cells. So it's working against a range of organisms here with a range of white blood cells. And the protective function of the respiratory mucosa was also decreased in the deficiency of vitamin A, as we've said. So quite clear in the author's conclusions. Vitamin A deficient rats have thicker alveolar basement membranes. That doesn't sound good, does it? So again, experimental evidence from animals being consistent. All this is consistent. It all seems to be adding up to a very coherent picture. The incidence and severity of infectious diseases are increased in vitamin A deficient children. This is simply what doctors and nurses see on the ground. Epidemiological surveys show that the incidence of vitamin A deficiency is significantly associated with age. The younger the age, the higher the incidence of vitamin A deficiency. This is a problem in children. And we've seen that this mycoplasma pneumonia is primarily a problem of children in China. The younger the age, the higher the incidence of vitamin A deficiency. Vitamin A deficiency was associated with severe mycoplasma pneumonia, and the supplementation of vitamin A may reduce the occurrence of severe disease in children. Makes perfect sense. Several studies showed that supplementation of vitamin A could reduce the incidence of respiratory infections and shorten the course of their disease. Good. Strange the WHO didn't mention this. Vitamin A deficiency was more likely present in younger severe patients with severe mycoplasma pneumonia, suggesting that supplementation of vitamin A is more important in younger children who have potential mycoplasma pneumonia infection. Final thing, Congratulations if you're still here. In our study, although we did not find a significant correlation between vitamins E and D levels with non-severe and severe pneumonia, vitamins D and E should be maintained at least the normal levels. It's just that they didn't find the deficiency in this study. So it all kind of hangs together there. The vitamin A deficiency could be a big factor. If this is the case, it's probably good news for Western countries. As far as we know, many thousands and thousands of children being admitted to hospital in China might not occur in countries which have adequate levels of vitamin A in their children. But I am concerned for Asian, particularly poorer areas, rural areas, slum areas of Asian countries where vitamin A deficiency is highly prevalent. This could lead to a big problem for the children of Asia. And you would think, ideally what we would have is an international organisation that would say, you know what, there's a big risk here of mycoplasmic pneumonia in children, and we know that lack of vitamin A is a big factor in this disease. Therefore, let's start optimising the vitamin A levels in children with vitamin E and D as necessary and nutrients. Optimise the immune efficiency of these children and make it much more or less likely they'll get disease. And if they do get disease, make it less likely they get severe disease. Pity we haven't got such what could we call an organisation like that would do that? Anyway, can't think of anything at the moment, but food for thought. Indeed. And if we do this, hopefully we won't need new, novel, expensive, experimental treatments. Having said that, new treatments are always good, as long as they're affordable by people, as long as people can afford them. But of course, prevention is always better than cure. Thank you for watching.